Good evening, ladies and gentlemen. This is Saki Pathan. Today, we have another topic, and we again welcome you, all of you, for this amazing knowledge sharing, and hope you and your family are safe. So today, with us we have Dr. Pratik Pawar from ZOETIS. He is Manager Technical Marketing in ZOETIS. So, good evening, sir, and very warm welcome from the FELINE Club of India.
Thank you, Sakib, and good evening, everyone.
Yeah. So talking about Dr. Pratik, so he has done his graduation in veterinary sciences from Bombay Veterinary College. Further, he's pursued veterinary master's degree in animal biotechnology from Bombay Veterinary College. He has also done diploma in clinical research from ACE, Bombay College of Pharmacy. He has been into small exotic animal practice for around 5 years, before moving to South Korea to work on a Salmonella ghost vaccine project on poultry birds. After that, he joined BBPL Hyderabad in R&D department, working on large and small viral and bacterial vaccine projects. Then he joined Zoetis India Limited and currently looking after, manager in technical marketing of companion animal business portfolio, vaccine, anti-infective, nutritional, parasital, dermatology, and diagnostics. He has also been associated with several research papers and have recently presented a study in Wasawa, Singapore, on dogs and cats and skin infection treatment with cephalosporin sodium in Indian context. He has also been part of several camps and workshops and always been associated with various NGOs working on stray animals and injured birds and reptiles. And to add a few things more, he has also been, an integral part of a lot of training programs that FCI has held in this COVID times. So, sir, I'm not going to tell much about the topic. What is something that we are going to talk, or what is that aspect about vaccination that we are going to discuss today?
Okay, so the topic for today is basically we've been focusing, of course, on the vaccination, but more towards on the kitten health and why it
Right,
is important on the kitten health and how does vaccination lay the foundation for a healthier cat life, adult life. So we will be touching on those aspects. So I will not go very deep on the disease part, but I'll try to look touch base on what is the important factors. So how is vaccination influencing other things? So right from the parents till the kitten and the adulthood.
right. And I think this is something very important aspect because when we talk about vaccination, we always like we as in the cat owners, we always think about the deadly viruses and the infectious diseases and all those sort of things. But the health of kittens and how it is connected with vaccination of the mother of the parents by and large. So that is something that we are going to discuss. So Dr. Pratik, over to you. We are anxious to see your presentation and know more about this topic.
Yes, thank you, Sakib, and I'm also excited to share information with everyone. So yes, can I share my screen?
Yes, sir, please.
Is the screen visible?
Right, sir. Over to you.
Yeah, thanks. So let me share. Yeah, it's visible, right?
Now it's fine, sir. You have to be on this window only.
Yeah, is it visible now?
Is it? It is visible.
Yeah, okay. So the topic of today's discussion is basically the vaccination, but a different aspect of vaccination. Not only we won't be talking much about the adult, but we'll be talking about how is vaccination is the foundation for a healthier life. So that is the reason we have given the topic name also. It's a stepping stone for a healthier life. So it doesn't only start with the adult, not only talks about the adult, but it lays a foundation for a kitten health. So before we start, so just wanted to give you a brief aspect that why vaccination is important for each life stages. So all the life for the kitten life stage, it starts from the healthy parents. So if the mother, the parents basically, the mother and the father, the tom cat and the queen is vaccinated, they are healthy, so they would be naturally giving a healthier they would be having a healthier immune system, they will be having a healthier reproductive system, and they will be they will be most important to give rise to something new. So that is the reason why it is important. Vaccination of the mother, fully immunized, it is important. So it is this is the first step of a healthier life. So once the mother is fully vaccinated, she what happens is that basically when she is fully vaccinated, she doesn't get infected, and during the pregnancy or before pregnancy, during the stages of pregnancy, she is protected from the viral infection, and the kittens, the embryo which is there in a uterus, it is also protected from all the deadly virus. So first, when we're talking about the vaccination, vaccinating the mother gives the prime protection for something which is going to be born next. So once the kittens are delivered, so her milk, the first milk, what we called as the colostrum, it is rich in maternal derived antibodies. So this makes the foundation of her healthiest, because this kitten doesn't have any protection. So whatever protection they have, they get a ready-made protection from the mother through something known as colostrum, and it has the maternal derived antibodies. That is what we call as MD. We'll look into that in more detail in the next slide. So this is what the first step. Even before the kittens are born, the protection is made, and when the kittens are born, their ready-made protection is already there because the mother has been vaccinated. So she transfer her antibodies to her kitten. The second step is basically when the kittens are still developing, till the time their immune system is not developed properly, the antibodies, the maternal antibodies which the mother has given, the vaccinated mother has given to the kittens, they are helping her, helping the kittens. So till the time they are matured enough, the immune system is matured enough to produce the antibodies of their own. Okay, so in the third stage also, it is protecting. It is all because the healthy vaccinated mother has given rich MDA to the maternal derived antibodies to her kitten, and later on when they are uh, matured enough, when the immune system is matured enough, they can prepare their own antibodies, and then they get into the active immunization. So from a fully vaccinated cat to the kittens, newborn kittens who do not have any protection of their own, to the till the time where they cannot produce the antibody of their own, till the time they are producing the antibodies of the every stage. Vaccination is very much important in laying the foundation of this of the life stages. The next thing, when we're talking about the vaccine, so we have seen the how vaccination is touching every part of the life stage. So why we need to actually, what is the importance of vaccination in general we are talking about? So as we know that vaccines will protect against all the disease, so we know about that. So we have heard about seen. So what are the other things which vaccine can help? Basically, even in spite of vaccination, we see that some animals, even in case of the current scenario where we see that we have been vaccinated but still we are infected. So what happens with the vaccination is basically when we are vaccinated, even if we are infected again, we do not suffer from the severity of the disease. We suffer, but the severity is not so bad. So in case of the current scenario where vaccinated people are getting COVID infection, they are not so sick that they need to be hospitalized. Same case over here. The kittens which do get the cats do get infected, they do not suffer from the severity of the disease. They suffer a little bit. Okay, second thing, many of the diseases has a lot of post-infection complication. To give an example, your flu vaccine, flu viruses, your rhinotracheitis and your calicivirus. So these diseases have a very long-term repercussions. Like there is infection of the trigeminal nerve or something, like there is a deformation of the nose and nostril. So or there is a different continuously the immune system is compromised. So these post infection complications, it can be saved from vaccination. Secondly, the what we talked about, the herd immunity. We might have heard about the herd immunity, but what is basically herd immunity? Herd immunity is basically when around 80% of population, 70 to 80% of population is vaccinated, the other 30% population, it gets protected. And what are these 30% population we're talking about? These are the population where we cannot vaccinate. These could be the young animals, or it could be those animals whose immunity is compromised, who are immune compromised. Such individuals are also protected when we vaccinate all the population, majority of population. So this is what we talk about, the herd immunity. So vaccination also helps those population where vaccine cannot be done directly. They are protected through the phenomenon known as herd immunity. Another thing is the zoonotic. Okay, so you know about the zoonosis diseases. Like for example, the most common one we talk about is rabies. So rabies is a very deadly disease. So when we are vaccinating the pet animals, we are indirectly protecting human counterpart from infection. There are a lot of other diseases also where are zoonotic in nature. So we protect the human ourselves also from when we are vaccinating the pets. Another thing is that if you look at the economics part also, vaccines are much safer, much cheaper option than a treatment. Okay, so whenever a pet is infected with disease, the cost of treatment goes very high, and not to compare the emotional toll. Okay, we cannot put a price tag on the immunity, the toll, emotional toll what the pet owner has to go everyone. So whenever a pet is sick, it's become all the uh, it cannot be price tagged. Okay, so that I'm not even talking about the emotional toll what is happening over here. But when you look at the economics, even the vaccines are always a cheaper option than a treatment. And who doesn't want a healthy and happy pet? So when you are vaccinating the pet, basically you're making sure that your animal is happy and healthy. So you are being a very responsible pet. Okay, so this is a part of a responsible pet ownership. And another thing, it also improves the quality of life, not only of the pets but or yourself also, because when your pet is happy, you're also happy to look at them, to play with them. This is all in general about what we talked about. So we have talked about these importance of vaccination earlier also. We'll look at a little bit on a deeper side when we're talking about what is the importance of vaccination in the kitten health. Okay, so when we are talking about a kitten health, the fully vaccinated or fully immunized parent can ensure a healthy litter. So, because what happens if the parents are healthy, they do not tend to get infected, they do not suffer from infection. As a result, their development is proper. When they're breeding, the pregnant cat is not infected. So, all the nutrition is derived toward development of the kitten. It is not transferred to recuperation. It's not. She is not trying to get the nutrition to help fight the disease. Okay, so it is all nutrition. All the nutrition is channelized for an healthier kitten. So you get a healthier litter. Second thing is the survival rate of the kitten. Okay, the survival rate of the kitten is higher. Many of the times, the infection can be transmitted to the kittens also when they are in the uterus. So, like for example, your Leukopenia virus, it has a vertical transmission. It can from the infected mother, it can directly go to the infected kitten even before the kitten is born. So it also helps in the survival rate. Then a vaccinated cat will have a very rich MDA, metal derived antibody. So your colostrum will be rich in the metal derived antibodies. So this all rich antibodies will be given to a kitten. So that is a plus point. Second thing, the antibody level, the maternal antibody level, which is produced, the quality and the quantity is good, so that the kitten has a prolonged MDA, like a longer MDA, longer level of antibodies and a higher antibody. So it protects to the maximum of her life, like for the kitten life, maybe till the age of your 5 to 6 weeks, which is normally what we consider. Second thing, the growth of the kitten is optimal. So because the kitten has a good MDA, the kitten tends not to get ill with common infection, and all the nutrition is channelized in developing of the kitten. So the kitten which is developed is and they can reach the uh, uh, optimum growth if you talk about it. Second thing, the kitten do not fall, they don't get infection, and they will not have those post infection complications. And as a result, you will have a healthier adulthood. Okay, so kitten which will form will have a, this is a foundation of a healthier nutrition, healthier adulthood. Then when we're talking about the vaccines, okay, so we have talked about what is the importance of vaccine in general, what is the importance of vaccine in kittens, and we can understand that what is basically vaccine. So, like you know, the vaccines are a biological property. It's not a chemical per se. It's a natural way. So all your natural bacteria or virus, whatever you require vaccines, antibodies against, these are the preparation. So this is basically the natural kind of a preparation. These are not chemical preparation, which resembles or these are some of the times these are the actual live viruses or bacteria what we use to make the vaccine, and these are given to the animal. And what happens is basically these are not pathogenic. So we do certain uh, things to these bacteria and virus so that they don't produce disease. Okay, they don't cause infection. And when they are administered, so what they do is basically they train your immune system to produce antibodies and your T cells. So what we are doing over here is basically we are just taking advantage of our immune system. These all process of creating antibodies and T cells is there in our body. So we are not doing anything unnatural. We are just stimulating the body to produce a desired antibody so as a result, when the real infection comes, we already have an antibodies and T cells which can directly fight. Okay, and when we're talking about the vaccines, so there are several types of vaccines. So broadly, they can be classified into maybe the type of antigen, like for example, there is a live virus and a killed virus, or it could be differentiated into the nature of disease. So some types we call that core vaccines and non-core vaccines. So we'll look into more details about the types of vaccine. When we talk about the types of vaccine, we will look into the live and the killed vaccine. So, first of all, the live vaccines, or they are also called as modified live vaccines, MLV, or are also called as the attenuated virus. Okay, we attenuate that. So, these are what are these? Is basically these are the safe small quantities of live virus, or it could be bacteria, which are injected into the body, and these viruses or bacteria will multiply in the body. Okay, but they don't multiply like a real virus. They mimic like a real organism. As a result, what happens, your body thinks that it is some real infection has come into your body, and all the process, your immune system process are triggered, and it will start producing your antibodies and T cells, and it will have all and this response is basically your immune response. So when we are using a modified live virus, what we get is basically a very strong, a very rapid, a very strong and a long lasting immune response in the form of your antibodies and T cells. And these kind of vaccines are the most preferred type of vaccines. The second type of vaccine when we talked about is the killed virus. So simply it is the virus or a bacteria which is killed. So we do some chemical process, or we heat kill the viruses or bacteria, and then we inject the same thing into the body. So what happens? It produces an immune response at the site of injection, and as a result, you have body antibodies produced. Okay, so these killed viruses or killed bacteria will not multiply because these are killed, so they are not very much immune. They themselves cannot produce a lot of immunity, or they cannot stimulate a lot of immune response, so they have to be accompanied by certain chemicals. Okay, these chemicals are called as adjuvants, so they adjuvate the effect. So basically these will not produce these will stimulate the body to produce antibodies against the antigen. They themselves will not stimulate to produce antibody against themselves. So this is how they work. So but like I said, the most preferred one is the live virus. And we have a lot of newer vaccines available now. Most of them are all live vaccines, and these vaccines are very safe, these are very effective, and these are painless. Okay, so many of the vaccines are painless. So what do you mean the painless is basically they do not have an adjuvant which can create any local inflammation, and these are very refined. These are very filtered vaccines, so all the debris are not there. So these are most refined, and that is why these are painless vaccine. And cats basically are very sensitive to any stimuli. They do not like. Uh, they react very faster to any stimulant. So that is the reason when we are talking about a cat vaccine, it has to be very pure vaccine. It has to be vaccine which do not create trouble in the cat. So these there are a lot of new vaccines which you can discuss with your veterinarians, or which are the painless vaccine way, and you can they can talk more about these vaccines. Coming to how does the immune system work. So before the vaccine, how does the vaccine works, we need to understand how does the immune system works, because vaccine is basically using our immune system pathway itself. Okay, so we do not, vaccine doesn't do anything different. It is only making use of the immune system to produce antibodies. That is the reason we need to understand how the immune system works. So just to give you an example, there is a image how the whole system works. So whenever a macrophage, maybe macrophage are WBC cells. Okay, whenever any antigen or any foreign body or any germ comes into the body, what happens? Your WBC cells are always there. WBC cells are like your policing cells. They are circulating throughout the body 24 hours a day, so they're always there. So whenever there is something foreign to the body, these cells come to know that this is something which is foreign. So they will catch hold of it, and they will what will do, they will make pieces of that, and they will pick up the receptor, the antigen. Okay, and these they will take it to the T cells. Now the T cell will do two things. Now it will either will go to stimulate the antibodies or go to stimulate the T cells. So these are done by the T cells and T helper cells. So after that, it goes to the T helper cells. T helper cells decides what to do, and then it stimulates your antibody, that is your B cells. So B cells, it stimulates the B cells, and B cells start multiplying, and it sheds the receptors. And these receptors are those Y shape as all your antibodies. Okay, so antibodies look like a Y shape, and T cells are basically a cells. So these macrophages will stimulate either the B pathway, that is your antibody pathway, or your T cells, that is a T cells pathway, or it can do both. So depending upon what kind of germ it is, what kind of antigen it is, it can stimulate one path or the second part or the both part, depend upon that. So what happens is that the T cells will produce lot of T cells, B cell will produce lot of B cells, and these are how it works. So these receptors, they are circulated into the blood system. So it goes throughout the body, and wherever you find the same germ, it will attach to those receptor, and as a result, the germ is ready for destruction. So it cannot do anything. All its receptors are sealed, and the germ cannot do anything. Okay, so this whole thing happens, and it takes some time. So generally, whenever an antigen comes in the body, it takes a couple of days to weeks. Also, it depends upon what kind of antigen it is, how complex it is. So generally, we talk about that it takes around 2 weeks to 3 weeks to have a very optimum immune response. Okay, and so what happens that the body tries to remember this thing. So because since it is taking too much of time, it cannot do that every time when the same antigen comes. So what it does is that basically it makes copies of itself, and it preserves it. So like how we have like your hard disk where you store the infection, same way the immune system stores the infection information in something called as the memory cell. Okay, so whenever the same antigen comes again, it doesn't waste so much of 2 weeks of time or 3 weeks of time. It start producing directly your antibodies and T cells within few days, and it start neutralizing. And that is the reason we take advantage of that. So when we are giving a small kind of infection, the body doesn't get affected so much. It has enough of time to produce all this thing. It has enough of time. If in case directly a virus comes, a virulent virus comes, the body will be overwhelmed with the infection, and as a result the animal gets sick, and it will produce antibodies, but it may not be producing the antibodies at so faster rate. So this is the reason why we use antigens, your vaccines basically, where minute quantities of infection are given, and it produces antibodies. And whenever the real infection comes, the body is already ready with the solution. And all this thing happens in something known as a lymph node. Okay, so your cat, even we have the lymph node over here in the inguinal regions and all. So whenever you have some infection, you feel some swelling over here. Even the cat has, if you could feel that if she has infection, she might have the swelling of the lymph. So these are the signs of that infection is happening. So all this thing happen in the lymph node of the cat. Okay. So coming to the next part of the colostrum. So once the mother is vaccinated and she has delivered the kittens, she starts secreting the milk for the kitten. So there's the first milk which is coming, which comes out is basically the colostrum. We call it as a liquid gold because it is very precious. It is very precious and it cannot be mimicked. It cannot be prepared. So we cannot create colostrum. We can create milk formulas for the kittens after for the nutrition, but for the antibodies, ready-made antibodies, we cannot create a colostrum. So this is very important, and it is something which is produced immediately after giving birth, and it has to be given very immediately to the kittens. There is a reason for that. Okay, so what is the reason is basically your kitten or your pup's gut, your intestine is initially porous, and these antibodies are huge in size. These are microscopic, but they are huge in size. So they need to be absorbed. So whenever the kitten or the puppies are drinking the milk, the antibodies are directly absorbed through the intestine and going to the blood system. Okay, and as the time passes, these porous holes start shrinking, and after 24 hours the holes disappear, and it will be the antibodies cannot penetrate to the intestine. Okay, so that is the reason. If it happens to be like you may ask that basically why not 48 hours, because as soon as the pup or a kitten is born, they are also exposed to all kind of infection also. So the germs and all are all same size of your antibodies, so they can also penetrate through the intestine and go into directly to the system. That is the reason the porosity of the intestine cannot be prolonged for a very long time. Okay, now this colostrum is nutritionally rich not only in the antibodies but also the hormones and nutrition, which is basically all the cocktail which is required for the initial survival of the newborn. Okay, it's very important. And another thing is basically why colostrum feeding is required, because in dogs and cats, basically 90% of all the maternal antibodies are transferred from mother to the kittens and the pups through the colostrum only. Not like us, like humans, basic mammals. Basically, we transfer a lot of maternal antibodies through the placenta, and some through the milk. So even we have this colostrum, but their colostrum is much richer because a lot of antibodies. 90% of antibodies, maternal antibodies, are transferred through the milk, okay, through the colostrum. And the important fact about this colostrum is basically colostrum will be the mimic of what the immunity of the mother is. If the mother doesn't have a good immunity, the colostrum will not be rich in the maternal antibodies, because over the life cycle of her, whatever organism she has been exposed to, whatever antibody she has produced, the same set of antibodies she will be transferring to the kittens. If she is not vaccinated, she will not have the antibodies for the core diseases, and she will not be able to protect her kitten with these initial antibodies for the initial period of time life cycle. Next is looking a little deeper in the maternal antibodies, because as we said that maternal antibodies are very important. So these are basically your ready-made antibodies. Like I said, mother will produce antibody which she has been exposed to, and that antibodies are transferred from the mother to the kitten. So we call it as a passive antibody or a ready-made antibody, because your kitten doesn't have to do anything. Their body doesn't do anything. It's a mother's antibody which has been transferred. That is called as ready-made antibody, and it varies between the litter. Why does it varies between the litter? Is basically, see, as I said, it is transferred to the colostrum. So it is very important for the kittens to feed on the colostrum as soon as they are born. If in case of litter of three kittens, if one kitten drinks a lot of colostrum, second drink average, and third doesn't drink a lot, the third kitten will not have a lot of antibodies, or maybe very less metal derived antibody, whereas the kitten one which has drink a lot of colostrum, he will have a lot of antibodies, so he will be protected properly. The kitten which is not which did not had the colostrum properly will not be protected. So that is the reason why you within the same litter you see a lot of variation in the maternal antibody. Another thing that is another reason why not all the kittens will be protected within the same litter. So you might think that okay, the same litter, the kittens look healthier. One kitten look much healthier after going forward, but another kitten is falling sick many a time. It could be the reason that he doesn't have a lot of maternal antibodies, so it may not give a same protection to all the kittens. Secondly, your this all metal derived antibodies can be achieved, the proper can be achieved by proper immunization of a mother. Like I said, it's all what the mother has. So your mother needs to be, your cats needs to be vaccinated. Primary vaccination should be done properly. Your annual booster should be done properly. Okay. Another important fact about metal derived antibodies is that we talk about that maternal derived antibody protects the kitten in the initial phases of a life, but it can also interfere. Okay, this is another fact about why we very few people try to understand this thing, because we only think that maternal derived antibodies only protect, but they can also interfere. Okay, and that interference is basically your immunity gap. Okay, where your maternal derived antibody is enough, not so enough to protect, but it is enough to interfere. So to give you an example, how does it work? I can show you with this graph. So if you can look into the graph, the arrow up is talking about the level of antibody, okay, maternal derived antibody, and the arrow in the bottom shows about the kitten age. Sorry. You can look at, there are on this example I'm giving you an example of two kittens. Basically it could be many kittens over here. So the first kitten and the second kitten. So initially itself you can see that the kitten one MDL level is lower, and your kitten 2 MDL level is higher. And if you look at the level, the dotted mark over here, so level A talks about the protection level. So this is the line, this is the level, this is the minimum level, which minimum level of antibodies should be there in your kitten to be protected against a particular disease. If it is lesser than that, it means that the kitten cannot be protected with an infection. And if you look at the level B, which is talking about the level, the level at which the antibodies, so metal antibodies can interfere with the vaccines. So imagine that from the level A to level B, it has to come down to level B, okay, over a period of time to for an animal, for a pet, basically for the vaccine to work. So that gap from level A to level B, the time phase, if you can look at over here, this is ranges between 1 to 2 weeks. Sometimes it can range a little longer also. So this range, what we talk about, is a immunity gap where the antibodies are present in the body, but they cannot protect, but they are so high that they can interfere. So this is what is the immunity gap, and our intention is to reduce the gap. You cannot nullify the gap. Whatever you do, you cannot nullify the gap. The gap will always be there. But what we can think is by proper vaccination schedule, you can minimize that gap. So instead of 3 weeks, we can bring it down to 1 week. So how do we do that? Is by series of vaccination. Now, this is when we know what is the level of antibodies of kitten 1 and kitten 2. But in the normal case, in the current, in the ground reality, it is impossible to know unless and until you do a testing to understand what is the level, which is not practical always. So we don't know what is the level of antibody against each litter. So what we do as a veterinarians is basically we give a series of vaccination at every. So I'll share the vaccination schedule. So what it ensures is that the kitten, at whichever stage it is, some immunity will start triggering, and as a result of it, they will have an active immunity. Okay, so and again, I want to reiterate that MD is important, but it can also interfere with the vaccination. So when we're talking about the same thing, when we're talking about the vaccination schedule, this is why do we have a different vaccination schedule? It is the reason because of that. So the common vaccines what we use is a combination of three antigen. So it's a one single injection with three antigen. So what we do is basically what we follow is the Vasava guideline or WAHA guideline or AAFP guideline. So all these guidelines talk about the same series, vaccination schedule. That is, the vaccination should start from 6 to 8 weeks, and every 3 weeks interval, you start giving a booster. Okay, till the time the kitten is of 16 to 20 age. So it depends upon the other factors also, what is the prevalence of the disease. So this is the guideline which is overall common with every countries. Okay, so we also adopt to this country. A little bit changes would be there depend upon the prevalence, the vet's experience, and the manufacturing guidelines. So every manufacturer, vaccine manufacturer, will give the guideline. So it depends on many factors, but this is the recommended schedule. So it starts from 6 weeks of age, and every 3 to 4 weeks you give a booster. Okay, till the time the kitten is reached around 16 week of age. Sometimes the doctors want to give it 20th week of age also. It can happen so. And anti-rabies is basically given at 3 months of age. So in since India is endemic, we have to again give a booster after a month or so, after 3 weeks. So it depends upon that. So again, it will depend upon the prevalence of disease over here, and then an annual booster has to be given annually. Sometimes doctors would prefer to give one more injection after the finishing the primary vaccine at 6 months of age. It can so happen. So it depends upon the preference of the veterinarian and his experience. So this is in general what the vaccination schedule look like. So it starts from 6 weeks of age till every 3 weeks till the time the kitten age is 16 weeks. So what happens is basically wherever the kitten maternal derived antibody level is there, the vaccine is still given so that it will neutralize and produce an active immunity. So when we're talking about the vaccines, when talking about what kind of vaccine, we need to talk about what kind of important diseases. There are a lot of important diseases, and these vaccines are basically targeted towards these important diseases. So your first important disease, commonly called as cat flu, is a combination of your herpes virus and calicivirus, and the second one is your panleukopenia. So cat flu vaccine, as the name suggests, is it will cause a flu, but it's not like a simple flu. It is a viral infection. It's a very deadly virus. The cat may not die with the infection, the kitten may not die, but there are a lot of problems created in the cats once it is happening. So there is an infection of your eye, your nose, your mouth, your gums start bleeding, the kitten's gums start bleeding. There is lacrimation, there is secretion, nasal secretion, and even in spite when the kitten recovers, there are a lot of complications, like there is a deformity of the nose, there will be a deformity of the gums, so much so that the gums tend to bleed a lot, and the vet may have to remove all the teeth also, because every time the cat starts to eat anything, the gums start bleeding. The second thing, your panleukopenia virus. So panleukopenia basically means your WBCs have gone down. So the virus attacks your immune system, and and your WBC cells are lesser. The kittens which infect with this will have diarrhea, vomiting. The body temperature initially rises and then it goes down. So there is hypothermia. There is severe dehydration, and the kittens normally die. So it's a very deadly disease. And another one we talk about the rabies. Rabies, as we all know, that is a very very deadly disease, and it is also a zoonotic important disease. So we need to vaccinate all your pets with rabies vaccines, and it is very important. So there is a misconception that cats do not get rabies, but there are a lot of cases where cats do get rabies, and cats, there are a lot of cases documented where rabies to the human has been transmitted to cats. So it's not a thing that cats do not get rabies and cats do not contribute to rabies infection in human. That is absolutely wrong. They do, and there are a lot of documentation. The only thing is that these do not get documented too much, but there are still cases we find of rabies. And there are a lot of other diseases which are coming, like your emerging disease. So these are the some of the emerging disease. Why do we call it emerging disease? Because these are slowly we are looking at into we are finding that. So these some of the diseases are being introduced when we import the cat. Some of the diseases are being underdiagnosed or were not diagnosed earlier, but with the advancement of your testing, we can effectively accurately test and actually find out diseases. So first one is your leukemia virus. That is the virus which causes cancer in your cat. The cat may not die very soon, but it starts depriving. Okay, it becomes very weak and over a period of time, and then it dies. So it's not a good. It's a very painful condition. Second thing is your feline infectious peritonitis. So you know about FIP. So I don't have to say much about it, but FIP is again is a very deadly disease caused by your feline enteric corona, and it gets mutated into the FIP form. Then we have chlamydia, bordetella. So these are causing your respiratory infection. So these are the some important diseases, and where we have thankfully vaccines to protect our cats and your kittens. And then we're talking about the disease. How do the disease transmit? So there are a lot of ways of disease can transmit. The most common is the direct contact. So you're sneezing when the one infected cat is sneezing. So this is depending upon what type of disease we are talking about. So all those diseases which are respiratory driven, these can be transmitted through your sneezing and coughing and co-grooming through the secretion. Other diseases, like for example, if it is enteric driven, so it can be transmitted to diarrhea. So in case of your panleukopenia, where the virus is shed through feces, when the cat is sharing the same litter box, they can transmit. One cat, infected cat, can transmit the disease to a healthy cat. To this, so this could be a more of an indirect contact also. So indirect contact basically would be through some objects like what we call as fomites. So utensil, your food, sharing the food, toys, or all by us also. When you are grooming infected cat, you're handling infected cat, and then after that you handle healthy cat. So you yourself can transmit that disease also. So we can be the factor of transmission over here. Then certain types, some disease can be transferred through vertical transmission. Like I said, in the case of panleukopenia, infected mother can transmit the infection to the kittens, and before the kittens are even born. And then when you talk about the secretion, secretion could be many type. It may not be only just oral secretion. It could be your tears. It could be nasal secretion. It could be your bodily fluids, your other secretions. Like so, these are how usually these diseases can transmit. Then we talk about another part is the deworming part. So when we're talking about immunity, we need to talk about the deworming part also, because worms are basically an important hindrance for a proper immune system. We'll go one by one. So first of all, when the kitten has worms, they deprive the kitten from the nutrition. This is one part. Second thing is that worms can transmit disease also. Okay, so certain disease worms can transmit certain diseases uh, to the animal. Third part is basically worms are basically what we call as parasites. So they want to hide in the body, and they want to derive take the nutrition from the animal. So what they do is basically they secrete certain chemical so that the immune system doesn't know that the worms are present in the intestine, and these chemicals will suppress the immune system. Okay, so these are suppressing chemicals, and this as a result your immune system is compromised. So whenever the kitten has a lot of worms in the body, the immune system will not work properly, the vaccine will not work properly, because your immune system is compromised. It already has certain chemical which makes sure that your immune system is not working 100%. Okay, so that is the reason you need to deworm the cat often, very often with, and you should follow the schedule. Second misconception over here is that once you're giving a deworming, your cat will not get worms. This is not the true case. So many of the times what happens, the adult worms are there in the intestine. Lot of times we see a pot belly kitten, like lot of worms are there in the intestine, and the kitten might excrete the worms. Sometimes they vomit the worms, and you give a deworming and you think that the worms have gone. You don't have to repeat the deworming, but that is not the case. The adult worm there in the intestine, but the larva stages will be there throughout the body. So once you get rid of the adult worm, these larva stages, which is there in the muscles or lungs and liver, they will again come to the intestine and start developing. So you need to have a proper deworming schedule, okay, to get rid of all the adult worm. It is not just one time you have to deworm. You have to follow the series of deworm. Okay, when we're talking about the worms, what kind of worms they are? Basically, there are three types of worms. One is the round worm, which is the most common what you see. Another one is the hookworm. So you may not differentiate between the round one and hookworm because they look similar. The third one is a tapeworm. So it is very, you can differentiate the tapeworm. These are flatted worm like a tape, and these usually the kitten which has these things, they will scoot and also, and very irritating thing what will happen. And important aspect about worming and worms is basically many of the worms are zoonotic. Okay, so what it means is that even we know about the virus and bacteria as being zoonotic, but the worms can also be this zoonotic in nature, especially the larval stages, the initial stages of the worms, the young ones of the worm. They can migrate into the surrounding, and it can, some of the worms can penetrate the entire skin, and once they're there in the body, they can wander around the skin. Sometimes they go inside the your organs. Many of the times what happens, the children's, they may not be, if they're playing with the litter box, they can have these larval stages ingested. So that is the reason whenever when you're handling the litter box, you should have a protection, wear some gloves, and after handling the litter box, you should clean your hands properly. So coming to the deworming schedule, so there are the deworming schedules for kittens. It starts from 2 weeks of age. So every 2 weeks you have to give till the kitten is of 16 weeks. Okay, so it makes sure that all the adult stages are gone, all the larva stages are gone, and whatever newer infection is coming, it is getting rid of it, because kittens will wander around. They will pick up infection very slow, very uh, rapidly. Okay, they tend to chew on something, they tend to lick on something, so that is the reason kittens get infected very faster with worms. And then you have to give it every month till the age of 12 months. What about the adult kittens? So when we're talking about adult cats, so it has to be given every month or every 3 months, depending upon what is the nature uh, of your cat. Like for example, if the cat is very adventurous and tries to chase rats, cockroaches, and all, which where they can infect it with your some larval stages, or the cat tends to go out a lot, then you have to deworm it every month. If it is strictly 1 month, sorry, strictly indoor cat, you need to deworm the cat every 3 months. Okay, the same goes with your pregnant and nursing cat. So we can, before the breeding, you have to deworm the cat, and during the third trimester, that is 50th day of pregnancy, you have to deworm the cat again. And then after that, after the kittens are born, you have to vaccinate, sorry, you have to deworm the adult cat along with the kitten from 2 weeks onwards. Okay, so this is the schedule of how do we deworm. And what are the products what we can use is basically there are a lot of combination products right now. So for oral, basically there is a combination of praziquantel and pyrantel. And similarly, we have a lot of spot-ons which can use. So you can use a spot-on which takes care of your internal and external parasites. For example, a salamactin. So salamactin is basically a monthly given. It's not something has to be given every 2 weeks. It's supposed to be given every monthly. You can increase the frequency depending upon the vet suggestion. Sometimes vet tend to give it every 2 weeks, but just follow the vet's advice. And these, when your cat is on the year round protection, it makes sure that the newer stages will not come. So it is something like kind of a maintenance a dose where it makes sure that new infection is minimized. You don't get newer worms in the body, and you eliminate the existing worms. When we talk about the adverse effect, so when we're talking about the vaccines, the main important thing is that many people think that what about the adverse events and how common they are. So basically, these are very, very, very rare. So these are some of the figures of some developed countries because the vaccination rate are very high over there. So in that countries where the vaccination rates are very high and lot of vaccines are also given, like over here we have two types of vaccines, your rabies and the multi-component vaccine. But over there they have different kind of vaccines. So in spite of having high vaccination rate and using a lot of vaccine, the incidence rates are very, very less, like 0.06 and 0.05, 006 and 0.05. So the incidence rates are very less. And what kind of reaction, you may ask, is basically the kitten or the cat would have lethargy. They may not eat for a day or two. Sometimes there is a localized reaction which subsides in within 2 or 3 days. Very, very rarely there could be an immune mediated reaction, and something known as your feline site sarcoma. These are very rare. I have never seen or documented any feline injection site sarcoma in India. So I've never seen anything. It's very rare that the cats might have a your cardiovascular shock. That is very, very less. I've never seen that. But as a result, when you're vaccinating the cat, tend to spend a little bit time in the clinic. Do not just rush, because if the reaction has to happen, the immediate reaction has to happen. These will happen in very rapid moment. Okay, so it will happen within few minutes. If the cat is allergic or something, or there is a cardiovascular shock, it will happen within minutes. So it is always better that when you're vaccinating your cat for the first time, spend some time after vaccination in the clinic, so that if there is any reaction or something, the vet can directly manage, and these all reactions can be managed with medicines in the clinic. Okay, so the end thing is that you have to weigh out you have to weigh out what is the benefit risk benefit ratio. So when you're vaccinating, you're making sure that the kittens are not getting exposed to lethal infections. The sites of the post disease complications are not there. The zoonotic aspect you're talking about. When you're vaccinating, there are certain chances of some reactions, but these are very less. So if you weigh out the benefit of vaccination against non-vaccinating, vaccination always works. Okay, so the benefit outweighs the risk. So just to summarize the whole thing, we need to, and what some important points about vaccination and about healthy cats is basically the vaccines are primarily only for the healthy animals. Okay, so your sick pets cannot be vaccinated. So how do you ensure the animal is healthy, your pets are healthy? It can only be ensured by regular checkups. Okay, so do not miss out on the checkup. Do not just take the kitten to the vet only for the vaccination. You take him for the regular checkups also, and it will not happen that on the first day itself they will vaccinate. They will observe the kitten, they will give the deworming, will get rid of the worms, and then once all the worms have been swiped off, you can start vaccinating. Nutrition is very important. So your balanced nutrition is important for optimum health and for developing a good immunity. Then starting the vaccination at appropriate age. So the vet will discuss what is an appropriate age. It starts from 6 weeks onwards, 6 to 8 weeks. It depends upon what is the preference over here. And do not vaccinate pregnant animal or kitten which are 4 weeks below of age, should not be vaccinated. And the guideline which the veterinarians is given, please follow those guidelines. Be there for those vaccinations. Deworm the cats regularly. You know about the schedule over here, so you should deworm the cat. You can get those medicine and you can deworm at your home. You don't have to be in the clinic to deworm the cats. every cat should be vaccinated. So when we're talking about cats, so core vaccines and rabies should be given to every cat. These vaccination not will only protect the adult cats, they will protect those cats which cannot be vaccinated, which are immunocompromised, those kittens which are not yet matured enough to have vaccine, so they will protected by the herd immunity phenomenon. And round year protection of ectoparasite and internal parasite is required. So stick to certain spot on, discuss with your veterinarian which are best suited for your cat, and always get your vaccination done by a qualified professional. Okay, so this is what this I have to talk about your today's topic. If there is any questions, I'll be happy to take that.
Thank you, Dr. Pratik.
Yeah,
Um, as always, you kept it simple, but yet it was filled with complete knowledge, and
thank you.
few important points that I decided to write them off because there's something that is always new in your top topics or in your presentations that is worth noting and implementing. Also, moving forward on this topic, we'll just take a few quick questions that were there because I think even if the questions were there, but they were later covered in the slides. When they were asked, they were not covered. So I won't really
Yeah,
bother with
yeah.
those questions because they already been discussed. But when we talk about this um, relation or integration of deworming and vaccination,
Mhm,
uh,
mhm.
first is like why you should deworm before vaccination, or let us start from is it necessary to deworm before vaccination, and if it is yes, then why, and what should be the ideal case, like the you should deworm it 1 day before or 2 days before, 3 days before the vaccination, or you decided to vaccinate, because also you said that health examination is also very important, which is a key factor, that it should not be assessed by you but a professional, so how
Yeah.
do you go about this, the whole relationship between vaccination and deworming?
Okay. So the relation as such that when we're talking about the worms, basically, so we call them the parasite. Why do we call them parasite? Is basically they are feeding off from the nutrition. So they work on three factors. So one is the direct is which they derive the nutrition through the sucking the blood on the nutritional content of the intestine. So first is the nutrition. Second thing is you're transmitting the disease. So these parasites can transmit disease. Third is the fact that they want to hide themselves. Okay, so any worms, they don't want to get out of the system, but our immune system is very vigilant. So whatever foreign comes into the body, we the immune cells will understand that this is foreign, and it will start something to get rid of the worms. So these worms are clever. So what they do is basically they will secrete certain chemicals which make them invisible to the immune system. And
Right.
these chemicals in the exchange, what they do is basically they will compromise the immune system. Okay, these
Mhm.
chemicals will compromise it. So whatever when you're vaccinating an animal which has lot of worms, the vaccine will not be 100% effective because your immune system is not 100% ready for that. Okay,
Okay.
so your immune system is compromised because of the worms. So what is an ideal situation is that you should get rid of all the worms. Okay, it will not happen that you will be able to get rid of all the worms. There will be certain worms which with maybe some stages over there. So what that is the reason when we are seeing the vaccine deworming schedule, it charts from 2 weeks of age, as early as 2 weeks of age, and every 2 weeks it goes on till the kitten age is 16 weeks. Okay,
Right.
so any but and this multiple time, what will happen in the body is that the worms, with the medicine, your worms are going out and some fresh infection is coming up. So every time there is something happening, it will not be an ideal situation where the kitten body doesn't have worms. It will always be there. So now coming to the fact that before vaccination, if you're scheduling a vaccination, so how often you should vaccinate, deworm? I would say that at least a week before you should deworm. It will take some time, and if you want, you can also deworm couple of days before the vaccination. So it will take time, but usually it may not happen. That is the reason when we talk about the series of deworming. So ideally, I would say is that a week before the vaccination, you should deworm.
You're saying a week before.
A week before it will, but again, it depends upon what is the prevalence. If I know that the kitten has a active worms and it has voided of the worm, I would again do after a week. It will
Right.
depend upon what is the situation. So the best way is to follow this guideline. If it is, you know that there is a lot of worms, you can always consult the veterinarian that do I need to deworm more often or not. So it will depend upon what is, because even they will identify the worms. So
Mm.
every your roundworms, your hookworms, they have a different vaccination. Sorry, deworming
Yeah.
schedule. Yeah.
Right. And you mentioned that as early as 2 weeks you should start for kittens, and then if I'm not wrong, you start with vaccination from 4 weeks and continue to 16th week. Uh,
6 weeks.
the
Six
6 weeks
weeks.
to 16th week.
Yeah.
So basically, which is like 1.5 months old. So I think you are following the vaccination cycle as well as the deworming cycle. So every
Yes.
even week you can go ahead and do that,
Yes.
and
Yes.
that's something that can be set. But again, as you said, there are no set rules. That there's no set rule that you should do it only on this particular
Yes.
day or 2 days before or a week before. I think it's always great that if you can get in touch with your vet, and then you both mutually decide and agree on
Hmm.
how the schedule is going to be.
Yeah.
So there is one more question, which is saying that is there any adjuvant and thimerosal free rabies vax available in India for cats?
Okay. Okay. So when you're talking about the rabies vaccine, basically, you have a killed vaccine. Okay. So none of the vaccines are live vaccine in India. So by nature of that, when you're using a killed vaccine, you have to be accompanying it with an adjuvant. So that is the reason every rabies vaccine, be it any brand you talk about, they will be having adjuvant. But these adjuvant over the period of times are so refined now that they don't cause any reaction. So that is the reason your cat would have been vaccinated, but you won't feel any pain as such. So these kind of we are moving to those era where we are talking about the painless vaccines for the kittens. So for their comfort and for the cat. So unfortunately, there are no vaccines. Thermocells, there are certain brands, uh, but if you should not be worried about the thermocell so much, because the mercury content, if you're talking, okay, were wondering about that relationship and the brain development, the quantities are so less that it will not be in the final production. When you're talking of per dose, it will not affect the brains and all. It doesn't happen, it doesn't work in that way. So this is something which is talked about a lot of time, uh, but it's nothing to be worried about, because we have a lot of pharmacovigilance data to support that, even in human cases and all, but it is not nothing to be worried about. Unfortunately, there are no adjuvant free vaccines for in rabies in India for now.
Okay. Um, yeah. So there's one more concern which
Yep.
says that can we detect from blood test if the arrived cats? I think Renuji needs to ask that if she has a new entry of cat in her cattery. So can we get the blood work done and understand whether the new cat has worms or not?
I would say the simpler way of detecting the cat has worm is basically by doing a stool test. Okay,
Right.
so yeah, you need to. That is a much simpler and much painless way of doing that. So you can collect the feces of your kitten, the new kitten which is there. First of all, isolate the cat if you are getting a different cat. So the first way would be to quarantine that cat, and then you can check the cat. You can do the stool sampling. You can send it to the laboratory. They will look at the eggs. They will, if there are eggs, it means that they will not have, probably they will not have worms in the body. But I don't know if there is a specific blood test to be done. Probably some antibody testing would be there, but I'm not aware of that. But the most common way of detecting worms intestinal parasite is basically through stool test.
Stool test.
Yeah.
Thank you. And Sana has a question that can deworming has an adverse effect on the cat who is already suffering from a liver issue?
Okay, it does deworming has an adverse effect on the cat which has liver
Liver.
issues? Generally, no. These are very safer alternatives. But again, you need to assess. You need to speak to the veterinarian, because what is the individual health of that cat we need to assess, because and another thing is that before, when your liver is compromised, what even the safest drug you do not give unnecessary. So if you have a current situation where the drug needs to be given, only then you would do that. But generally, you need it doesn't usually cost, depends upon the nature of the nature of the product what you're using. Secondly, what is the current situation, and third is what is the need of the, can we postpone it till the liver values come to normal. These are certain factors where you need to consider. Again, your vet would be able to answer those in much detail, because looking at the cat health.
Yeah. Also, Dr. Pratik, somebody suggested me that when you're giving deworming, specifically to the very young kittens, that time, just give them small amount of liver tonic and also probiotics, so that
Yeah.
or the impact can be reduced, or maybe the deworming will not. And if sometimes for especially the new owners, they will not give the specific um, dosage of deworming. It becomes very tough because now whatever we have in market, it will be like 4 kg one tablet, and
Yes.
at 2 weeks the kitten is 250 grams, or 270 grams or 300 grams odd. So to do that calculation, sometimes it goes out. So it's always good that you do a little bit of liver tonic and also probiotics, so that it absorbs the shock and doesn't kill the useful bacteria.
Yeah, see, deworming basically will not kill your intestinal microflora. Basically, these will be hampered when you're using when you're giving antibodies. Sorry, antibiotics for some
Antibiotics.
infection. Yeah, where especially your penicillin groups and your penicillin groups, they they would wash out your microflora. So in that case, probiotic will help. But in general, probiotic will help. So in the kittens, you need to have a healthy gut, so probiotic will certainly help. Liver tonic will also help. It may not be so certain vets are of opinion that because we are giving drugs to the chemicals to the kittens, sometimes the liver can the liver can get overwhelmed. So it can be supplemented with liver tonic, but that is individual decision of, because
Opinion.
there is, yeah, it is I like it. There are a lot of things which the veterinarians will uh, on their own experience will have derived. Similar case with the vaccination schedule also. So there are a lot of tweaking here and there, depending on what is the experience of. But these certainly will not harm. If it doesn't have any advantages, it certainly will not have a disadvantage when you're supplementing with liver diseases, liver tonics, and probiotics. Certain things. Another thing is that there are a lot of oral medications for deworming. So you can try to use that also if there is a dosing, because yeah, I understand that kitten, first of all, their body weight is lesser than, every week they are growing potential at a rapid rate, so you can do that. Yeah.
And also, we had a fantastic session last week about the
Yes.
spot-ons.
Yes. Yes.
We can always go ahead with spot-ons where you don't know the exact dosage
Yes.
and
Yes.
they won't
Yes.
be harmful.
Yeah, so we are in the era where we have a lot of newer drugs, lot of safer drugs, and a lot of flexible drugs which can be used, and as young as like your 6 weeks of age in cats, or 5 weeks of age. So we can be used in very younger kittens also. So we are in good time.
Right, sir. Thank you once again. And
Thanks.
it was great listening and sharing knowledge. It's always wonderful listening to you. And tomorrow again, we are coming up with a fantastic topic. It's on the infectious diseases and all you would like to know about the deadly viruses and the deadly diseases in cats. So Stay tuned for tomorrow. We are again having a wonderful webinar at 6 p.m. So thank you everyone, and thank you Dr. Pratik, and thank you ZOETIS. It's been always great and honor working with an organization like you, which are very keen on educating the masses. Thank you. Thanks a lot from FELINE Club.
Thanks, Sakib. Thank you, everyone.